This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks for joining us for USVI News. I'm Emily Matson. Virgin Islands Governor Albert Bryan Jr. has met with leaders of cruise lines. He even joined 15 other lawmakers and sent a letter to the director of the CDC pleading the federal government to allow cruise ships to set sail in the U.S. again. The letter laying out just how devastating it has been to the economy of the Virgin Islands, Puerto Rico, and several other states having cruise ships docked for over a year now. Well, Americans hoping to set sail on a cruise vacation from a U.S. port are at least one step closer now. The CDC has issued new guidelines to help the ships get sailing in U.S. waters once again. The new guidelines include daily reporting of COVID-19 cases and routine testing of all crew. The next phase also includes practice voyages to allow crews to test out the new restrictions on volunteers. The CDC shut down the cruise industry a year ago due to the pandemic. The industry has been calling for ships to start cruising again in July. However, the CDC did not say when it's going to allow cruises to resume, and it is the CDC's call. Florida Governor Ron DeSantis has threatened to sue the CDC if cruise ships are not allowed to resume operations soon. Meantime, Governor Bryan is also letting the community know they are cracking down on bogus COVID-19 tests. It has become a problem in the territory, and they're tackling it head on. Our USVI News' Ali Bourne-Vanek brings us all the details.
Governor Bryan at his press conference talked about an issue that was discussed at the previous press conference, which is the fact that some people are coming into the U.S. Virgin Islands with fraudulent COVID tests. The governor shared that now the territory is making arrests when it comes to anybody bringing in fraudulent COVID tests, and that this can come with jail time and fines.
True to our word, last week and this past weekend, we arrested 2 individuals for entering fraudulent, uploading fraudulent COVID tests to our portal. Now, not just the 2, because more arrests are coming. So if you're traveling, do the right thing. Get yourself a COVID test. Get yourself screened when you go to the States. Make sure when you're uploading a very pristine document that is true, that is not fraudulent, because these types of infractions are felonies. You can also face up to 2 years imprisonment in jail. These are the kind of things that we don't want to do, but we have to do in order to keep our community safe. The other thing I just want to tell you again, if you go out and get the vaccine, within 2 weeks of getting 2-3 weeks of getting your final shot, you're going to have positive antibodies. You go out, you get yourself an antibody test. Once you show positive for antibodies, you're good for 4 months. You can travel up, down, wherever you want to go, east, west, north, south, and you don't have to take another test to get into the territory. So that is a good thing. So encouraging you, if you want to be sure, take the vaccine.
Again, Governor Bryan and Government House are encouraging all travelers to plan in advance, take the time, take the COVID test, upload it to the travel portal, and that way when you come to the U.S. Virgin Islands, everything is good to go, and most importantly, the test is real. In St. Thomas, Ali Bourne-Vanek, USVI News.
Thank you, Ali. And as millions across the country continue to be vaccinated against COVID-19, some people are buying fake vaccine cards online. The Department of Health and Human Services and the FBI are investigating this growing trend. There's currently no federal system to to make sure that the CDC's vaccination cards are legit. Well, that makes it easy for scammers to make them. Experts say a digital verification or QR code may roll out eventually to prevent this kind of fraud. Experts also say when you do get your real vaccine card, don't take a selfie with it. Scammers are also pulling people's personal information from those cards posted to social media. Well, new evidence suggests protection from the Moderna coronavirus vaccine may last for several months. Researchers looked at samples from 33 people that were taken 6 months after they had received both doses during the phase 1 trial. So they found antibody activity remained high in all age groups, although the levels were a bit lower in those ages 56 and older. The scientists say there are ongoing studies to monitor the immune response beyond 6 months, as well as to determine the effect of a booster shot that could extend the antibody response and protect against emerging variants. A coronavirus variant originally found in the United Kingdom has now been detected in all 50 states in the U.S. It's known to be more contagious and deadly than earlier COVID-19 strains. Data from the U.S. Centers for Disease Control and Prevention shows more than 15,000 cases of the UK variant have been reported nationwide. Florida has the highest infection rate of the variant, followed by Michigan. The CDC is also monitoring 2 other COVID-19 variants in the U.S. from South Africa and Brazil. No word from the Department of Health in the Virgin Islands as to whether any of those variants have popped up in the Virgin Islands. Well, schools today have some new guidelines when it comes to keeping school buildings as clean and virus-free as possible. The CDC's just put out new rules for cleaning surfaces in schools, homes, and other facilities. The CDC boss now says the risk of infection from contaminated surfaces is very low, and a simple cleaning with soap and water is enough to reduce the spread of coronavirus. Disinfection is still recommended, though, when there has been a suspected or confirmed case of COVID-19 within the past 24 hours. The CDC also says fogging, fumigation, and electrostatic spraying are not recommended as primary disinfection methods. Meantime, Dr. Anthony Fauci says COVID-19 is spreading among children in team sports environments more than inside those classrooms. Fauci said when you track cases in schools, they frequently come from sports. He explained that's because kids on teams are spending long periods of time together, and masks are also frequently not worn while playing sports. Fauci made the statement while discussing COVID variants, which are now infecting younger people. A small college in southwest Colorado is now one of the first in the U.S. to require students to get vaccinated for COVID-19. Fort Lewis College is offering exceptions for things like religious or medical reasons. Otherwise, students at the liberal arts school will have to get a COVID-19 vaccine before returning to the campus this coming fall. Mark Salinger reports on why the school has made this decision.
The pandemic has taken away a lot of the social parts of college. For much of the past year, schools all around the state have gone to virtual learning. Now vaccines offer a chance to get back to that ever-elusive normal we knew before the pandemic.
The big thing is, the more students we can have vaccinated, the better chance we have of having a normal semester.
More than 280,000 students go to college in Colorado. Each school makes their own rules when it comes to who has to get the vaccine. There's only one school in the state that's mandated that all students be vaccinated before returning to campus in the fall. They're also one of the first in the country to do that. That's Fort Lewis College in Durango. The president of the school says it's their best shot at keeping students in the classroom safely.
Students would submit proof of vaccine, the vaccine card, or some other kind of proof that they had been vaccinated to be eligible to be in classes.
President Tom Striticus says mandating the COVID vaccine isn't all that different from mandating other vaccines that students are already required to have. 70% of classes are already in person. Here at the University of Denver, school leaders are hoping that 90% of students, faculty, and staff will get vaccinated. That's the goal. They're not mandating that everyone get vaccinated, but they're hoping that on-campus vaccination clinics will help them get there.
So we are hoping to offer vaccination on campus for everyone before the term ends this year.
Sarah Watamura is the COVID coordinator at DU and a professor in the Department of Psychology. She believes enough students and faculty will want to get the vaccine that they won't need to mandate it.
You actually have very good cooperation when people feel that they have choice and they have opportunity.
From football games to on-campus plays to in-person study groups, schools around the state see vaccines as a big step forward towards getting all of that back, one vaccine at a time. In Denver, I'm Mark Salinger, 9 News.